Welcome to Westgate Resorts 2022-23 Open Enrollment. Westgate Resorts is committed to offering quality plans and a well-rounded benefits package to their team members now and in the future. This is the time of year to review your benefits and select the plans that work best for you and your family. If you have any questions, please email them to benefits@wgresorts.com or contact your local team member services. So, let's get started. During this presentation, we will provide an overview of the benefits offered. We'll discuss our wellness program requirements. We'll review in further detail the specific benefits offered. We'll talk about how to enroll online with PlanSource and important next steps. Westgate cares about the health of you and your family and recognizes the importance of providing affordable coverage despite these rising costs. Please read below for important information regarding exciting changes to your benefits effective June 1st, 2022. This year's open enrollment period will be from Monday, May 2nd through Thursday, May 12th. Open enrollment is done through benefits.plansource.com. All team members are requested to access this system. Your elections will become effective June 1st, 2022, and will remain in effect until May 31st, 2023, unless you experience a qualified life event such as marriage, birth of a child, etc. If you experience a qualified life event during the year, you must notify TMS within 30 days from the date of the event, and you must log into PlanSource to change your benefits. Otherwise, you will be unable to make a change to your benefits until the next open enrollment period. New full-time team members become eligible for benefits the first of the month following 60 days of employment. If a covered spouse can purchase medical insurance from their employer, a surcharge will be added to your premium. You must log in to PlanSource to answer the question about your spouse's alternative medical insurance coverage each year or when there is a change. Deductible and out-of-pocket maximums are on a plan year. This slide shows a comprehensive list of benefits offered to Westgate Resorts team members. Any members wishing to add new dependents to coverage will be required to submit appropriate documentation. Coverage will pend until documentation is submitted and approved by Team Member Services. Premium changes will take place the first of the following month, after documentation is approved. Childbirth is the exception. This qualifying event date must be the date of birth. Dependent documents must be submitted within 30 days of effective date to Team Member Services. Below are acceptable forms of dependent documentation. For a spouse, the marriage certificate. For children, the birth certificate or adoption certificate up to age 26. Coverage ends at the end of the calendar year the dependent turns 26. Look for the dependent document instructions in the PlanSource document library and the dependent information page of the online enrollment portal. Westgate Wellness is committed to helping you achieve your best health. We have partnered with UMR to provide a comprehensive health and wellness program. Our wellness program provides personalized awareness, education, and coaching to all medical insurance participants, both to team members and their covered spouses, on our group medical plans. For participation in the Westgate Wellness requires you and your covered spouse to complete a clinical health risk assessment, participate in biometric screenings, be tobacco-free for a minimum of 6 months. If a team member and/or their covered spouse did not complete all of the above requirements, the higher non-wellness rates will be assessed beginning June 1st, 2022. If a team member and/or their covered spouse tested positive for tobacco nicotine or did not complete the tobacco nicotine test, the higher non-wellness rates will be assessed beginning June 1st, 2022. New hires and newly enrolling team members have 30 days following their effective date to complete the wellness requirements. Team members and their covered spouses who are moderate or high risk must complete a CHRA review for moderate or coaching for high by December 31st. Westgate Resorts provides wellness participation incentives as shown in the chart. If you do not meet the requirements to earn a reward for a biometric screening target or being tobacco-free, you may complete your required coaching activity, for example, a CHRA review for low-moderate risk, a UMR disease management or real appeal weight management coaching for high risk, or tobacco cessation coaching, plus complete 9 sessions of real appeal, 3 action plans, or view 4 of the Infinity Wellness videos prior to December 31st, 2022 as the program's reasonable alternative. Action plans take at least 8 weeks to complete. Members wishing to complete the requirements for reasonable alternatives should enroll in action plans by November 1st, 2022 in order to complete them by December 31st, 2022. Cash incentives will be processed through payroll on a semi-annual basis this year. Please allow 6 to 8 weeks after the completion of your annual physical to allow verification from UMR for processing. The payout dates are listed here. If you elect medical coverage, you will be asked to complete the tobacco affidavit question during your online enrollment each year. This year, we are offering an additional medical plan called the Health Scope Plan, or HSP. The new HSP plan is available to team members who live within Orange, Osceola, Seminole, or Lake counties. This medical option is a new, affordable plan with reduced premiums, lower deductibles, lower out-of-pocket maximums, and lower coinsurance compared to the base plan. This plan removes network restraints on some services, allowing you to freely choose healthcare providers and/or facilities while reducing the overall cost of your healthcare. The HSP plan provides access to healthcare facilities and providers in the Imagine Health Network, Orlando Health. Use an Imagine Health provider gives you the best price and benefit from your plan. Even so, you may still choose freely from all licensed providers and facilities in your area without a network penalty. When you see a non-Imagine Health provider, the plan's pricing is based on a percentage of Medicare's allowable amount for services, and you could be balance billed. You will also receive the benefit level as reflected on the benefit summary. Non-Imagine Health will be more out-of-pocket than if you see an Imagine Health provider. Refer to the benefit summary on the next slide. The next few slides will help you understand the advantages of this new plan and how it works. The Health Scope HSP plan provides less out-of-pocket cost when you visit an Imagine Health network provider. When visiting an Imagine Health provider or specialist, you will have a $20 copay, specialist $40, urgent care $75, and $300 for emergency room. We will touch on urgent care versus emergency room further into the presentation. If, after you are seen by your Imagine Health provider or specialist, and they determine that you need to have outpatient service or surgery, you will be responsible for the deductible of $750 individual or $1,500 per family, then 20%. If you are admitted to the hospital, You will also be responsible for the deductible and 20% up to a maximum of $3,500 for an individual and $7,000 for a family. If you decide to go to a non-Imagine Health provider, you will pay more out of pocket as shown here under the non-Imagine Facilities Network. You and your family will pay higher deductibles, out-of-pocket maximums, copays, and coinsurance. You could also be responsible for a balance bill from the provider of the service. Teladoc Virtual Visits is a $10 copay at the time of the call. Maxer Plus will be your provider for prescriptions, $15 for generic, $40 for brand name, $60 for non-preferred for a 30-day supply. WG Meds is our voluntary program for certain brand name maintenance medications at no cost to you. This will be discussed further on the upcoming slides. Imagine Health has partnered with Orlando Health. Be sure to visit www.imaginehealth.com to find a provider and receive the highest level of benefits with the HSP plan. If you currently see an Orlando Health provider, please be sure they know you are covered under a new plan. The HSP plan covers medical services for physicians, hospitals, and facilities. You decide at the time of service, do you want to receive the best coverage under this plan? Then you will want to make sure you are seeing an Imagine Health provider. Your responsibility will be a lower cost share for the Imagine Health network of copays, deductible shown on the summary, and you will not owe your provider anything more than what is shown. There is no balance billing for the service. However, if you decide to select any facility or provider, you will owe whatever deductible, coinsurance, or copays are due based on the non-Imagine network plan schedule for that particular service and the price that is based on a percentage of Medicare. You could owe more or be balance billed. The HSP plan is a new type of plan. It's possible that some providers may see your new ID card and tell you they don't take your insurance. Occasionally, a provider may say you have to pay in full, up front to receive services. Sometimes, after a provider receives the fair payment, the provider may bill you additional dollars above the reference-based price. When your claim is paid, your provider receives documentation of how the price was determined. Your provider may dispute the price. There might be possible roadblocks or service refusal by your provider. When seeing your healthcare provider, present your member ID card. Your ID card outlines what networks are used by your plan. It also gives the contact information for HealthScope benefits so that your provider may reach out to them with any questions. If your provider has concern about how your plan works, please ask them to call HealthScope, the number on your ID card. The customer service team can quickly explain the plan so that your provider feels confident about their upcoming reimbursement. You may also be connected to a patient advocate that can negotiate a price for services to ensure your provider is satisfied with the reimbursement amount. Do not pay in full for services up front, except for perhaps your copay or a portion of your deductible if owed. Otherwise, your provider will be overpaid, and you will have to collect any overpayments from the provider yourself. A balance bill may be sent to you or your covered dependents from the provider. So, what makes a balance bill different from any other bill you might get for your normal cost share, such as your copay, deductible, or coinsurance, that's owed to the provider? A balance bill refers to any bill from the provider that asks you to pay for dollars that you do not owe per plan provisions, as shown in the example below. Make sure to open your mail. If you receive a bill from the healthcare provider and it is for an amount beyond what you owe, contact HealthScope Customer Care using the number on your ID card. Please have your balance bill with you when contacting customer care, as they will need the information to assist with your claim. Follow the phone prompts to be connected to the appropriate team to handle your balance billing situation. In addition, if you get a bill and you aren't sure if it is for more than what you owe, call. Customer care agents and advocates are here to help you and take away the worries of provider billing. When calling HealthScope Customer Care about a balance bill or concern about provider access, you are assigned a patient advocate to personally handle your case. Your advocate is either a team member at HealthScope Benefits or one of our vendor teams. They take up all communications with the provider about your bill. They work your billing concern to closure and keep you informed along the way. For service issues, they will work with your provider or offer direction to locate a provider and service you need. The advocate shares pricing method details with your provider, and when necessary, has authority to negotiate a higher price. If a higher price is negotiated, the plan may make an additional payment. Rest assured that any provider dispute will be resolved. Your patient advocate has it covered. Here are some important links to the HealthScope member portal and Imagine Health Network, Orlando Health, to look up providers. Your ID card will be mailed to your home. It will look similar, but may differ slightly. You'll notice HealthScope, Imagine Health, and Maxer on your ID card. The minimum plan provides access to healthcare facilities and providers in the UMR Choice network. It is available to all team members and will offer the lowest premiums and per pay period deductions of all the medical plans offered. When electing this plan, be sure you are aware of the deductible of $1,500 per individual and $3,000 per family, which will need to be met prior to UMR paying any portion of your eligible services. After you have met your deductible, you will then be responsible for 30% of eligible charges up to your total out-of-pocket maximum of $4,000 per individual and $8,000 per family. Once you have met your total out-of-pocket maximum, UMR will pay eligible charges at 100%. You will also be eligible to open a health savings account, which we will discuss in further detail on the next slide. All medical plans, preventative coverage are at 100%. Preventative care services are such things as annual physicals, well woman annual exams, mammograms, immunizations, colorectal cancer screenings, and well child care. Members on all medical plans using specialty medications will go through Maxer Plus Specialty Pharmacy Program. Specialty medications are those that may require ongoing clinical oversight and education for best management. They may have unique storage or shipping requirements, or may not be available at retail pharmacies. This program provides the resources and personalized, condition-specific support needed to help better manage the condition. So what exactly is a health savings account? An HSA is a special type of bank account designed to help you save and pay for qualified medical expenses. In simple terms, it's like an IRA for your health. But with an HSA, you don't have to wait for retirement to spend the money. You can use it this year, next year, or years from now. An HSA works like this. First, you open an account and deposit money into it, income tax free. The funds in the HSA belong to you. You own the account from the day you open it. There's no use it or lose it rule like there is with flexible spending accounts or FSAs. The account is with you as long as you want it to be, even if you change jobs, lose your job, or choose a different health plan. You save on taxes. The money you put into an HSA is tax deductible. You don't pay federal income tax on HSA contributions or state taxes in most states. And any money you take out to pay for qualified medical expenses is income tax-free too. You can use your HSA to pay for qualified healthcare expenses for you and your family now and in the future. The health savings account plan can be broken down into two parts: the high deductible medical insurance and the savings account. The high deductible insurance will act as any medical insurance plan would, protecting you from medical bills through preventative services, deductibles, coinsurance, and out-of-pocket maximums. The savings account will allow you to pay for your deductible and any other eligible expenses with pre-tax dollars deducted from your paycheck. It will also serve as a tax-deferred savings account. This slide gives you an example of the savings when you contribute to an HSA. What you contribute affects the amount of savings you will see. You own the HSA account, and the contributions made this year can be used next year or years from now. You don't lose your HSA contributions. You are offered three healthcare accounts: a health savings account or HSA, an FSA medical spending account, and a dependent care account. Your choice between the medical insurance options drives your eligibility for each account. To be eligible for the HSA, you must be enrolled in the minimum HDHP plan. To be eligible for the FSA or DC FSA, you may be enrolled in the minimum, if not enrolled in an HSA, base, HPP, PPO, and HSP plan. For all three plans, the funds can be used towards eligible healthcare expenses. A more expansive list of these expenses can be found in the Plan Source Documents Library or the IRS website. With the HSA, your funds will roll over from year to year. With the FSA and DC FSA, any unused funds will be forfeited after the grace period. Please take a moment to fully review the chart to evaluate which account best fits your needs. You can access your HSA balance by logging in to the umr.com site. Select the Account Balances tab. View your HSA balance information. It also features a link to Optum Bank for full account capabilities to pay bills, make deposits, manage your investments, or view your transaction history. An HSA can also lead to savings on your tax return. Your health savings account is here to help you pay for qualified medical expenses, big or small. This includes anything from prescriptions to contact lenses. Reminder, you can do your HSA banking on your member website, umr.com or optumbank.com. Please refer to the next two slides for further details on the health savings account. If you are interested in an HSA, please read this slide for things to know about your HSA. Here are some more things to know about an HSA. Base Medical Plan provides access to healthcare facilities and providers in the UMR Choice Network. The Base Medical Plan offers slightly better coverage than the Minimum Plan, since you have copays for services without having to meet a deductible first. The copays are as listed: for primary care visits at $40 and specialist visits at $60. The Base Plan has the same deductible and out-of-pocket maximum as the minimum, but you will only need to meet the deductible when you receive inpatient or outpatient services. The deductible decreased this year to $1,000 for an individual, $2,000 for a family, and out-of-pocket maximums $4,500 for an individual, $9,000 for a family. But this still allows participants to save money on premiums. This type of plan is ideal for families who do not use their health insurance plan very often and want to have more control on how they spend money for health care. Urgent care facilities, walk-in retail clinics located inside your pharmacy, and your primary care doctor are far less costly than the ER and should be used for non-emergency treatments when possible. Top examples of non-emergency diagnosis that could be treated at one of these facilities instead of the ER include urinary tract infections, headaches, lower back pain, dizziness, viral infections, bronchitis, knee pain, and diarrhea. Prescriptions will have a $300 deductible for individuals and $600 for a family to be met first, and then copays will apply at $10, $50, $75 for a 30-day supply. Mail order is also available for prescriptions requiring more than a 90-day supply. Also, on all medical plans, members who purchase brand name prescription drugs will pay a higher copay than they would for purchasing generic drugs, unless their doctor indicates that the prescription should be a dispensed as written. The HPP plan also provides access to healthcare facilities and providers in the UMR Choice Network. The HPP plan provides less out-of-pocket cost when you need services, but will cost more in premiums than the minimum and base plans. When visiting a PCP, you will have a $20 copay, specialist $40, urgent care $50, and $300 for emergency room visits. We will touch on urgent care versus emergency room further into the presentation. If, after you have seen your PCP or specialist, and they determine that you need to have outpatient service or surgery, you will be responsible for the deductible of $300 for an individual, $600 for a family, then 30%. If you are admitted to the hospital, you will also be responsible for the deductible and 30% up to a maximum of $3,500 for an individual or $7,000 for a family. Prescriptions are $15 for generic, $40 for brand name, $60 for non-preferred brand name for a 30-day supply. Again, remember, WG Meds, the voluntary program for certain brand name maintenance medications, is available at no cost to you, a $0 copay. The PPO plan provides access to healthcare facilities and providers in the UMR Choice Plus network. With the PPO plan, you have the flexibility of going in or out of network. In network, you will need to visit UMR participating physicians and hospitals. While going out of network, you can visit a physician or facility of your choice, but this will mean more out-of-pocket expense to you. In network, you will have copays for the following services: PCP, specialist, urgent care, and emergency room. If, after you are seen by your PCP or specialist, and they determine that you have need to have outpatient service or surgery, you will be responsible for the deductible of $500 per individual, $1,000 per family, then 20%. If you are admitted to the hospital, you will also be responsible for the deductible and 20% up to a maximum out-of-pocket. The in-network out-of-pocket maximum is $3,500 for an individual, $7,000 for family. Your prescription copays for a 30-day supply under this plan are $15, $35, and $55. Mail order is also available. Going out of network, you have a $1,000 individual, $2,000 family deductible, 40% coinsurance, and $6,000 individual, $12,000 family out-of-pocket maximum for all services. Again, remember, WG Meds, the voluntary program for certain brand name maintenance medication, is available at no cost to you, a $0 copay. This slide shows the medical bi-weekly rates for team members and their family. This slide shows the medical weekly rates for team members and their family. Westgate has partnered with OneDrop, a holistic diabetes self-care program, to provide diabetes coaching, which will be separate from the UMR coaching program. Once enrolled, you will receive a smart glucose meter that wirelessly connects to the mobile app and an unlimited supply of strips and lancets delivered to your door. Through the OneDrop mobile app, you will receive one-on-one expert coaching, structured education, and guidance. There is also a carbs and calorie counter with a food database and barcode scanner. As a member, you and your family will receive access to U.S. board-certified physicians who can consult, diagnose, and prescribe medication if deemed appropriate via interactive audio or video. Regardless of the time and location, you can connect with a physician for common and acute illnesses. The physician will be able to review your telemedicine record, discuss symptoms, and treatment options. Some of the benefits of Teladoc include 24/7 365 access to a physician, speak to a doctor at work, traveling, or from the comfort of your own home. Save money by avoiding expensive ER and urgent care visits. Examples of when you use Teladoc include: you're considering going to the ER or urgent care for a non-emergency issue, at work, home, or on a business trip. You do not want to sit in a waiting room with other patients. The Cigna EAP is available to team members and members of their household. You do not have to be enrolled in any of the benefit plans to take advantage of the EAP. EAP provides a variety of services that will support your work-life balance. You can get referrals and information for family care, including, but not limited to, child, elder care, and special needs care. Members of EAP are eligible for 3 face-to-face licensed counseling sessions. You can also visit the Online Education and Resource Center to find information on topics ranging from healthy meal planning, to parenting, to getting organized and setting goals. Just about any topic you can think of related to behavioral health and well-being can be found in the EAP Online Resource Center. Real Appeal is an online weight loss program available at no cost to eligible Westgate Resort team members and families enrolled in the UMR medical plans. When you enroll in this program, you are offered coaching support for a full year, a toolkit, a scale, exercise DVDs, a food guide, and much more. Eligibility is for team members, spouses, and dependents 18 and older. To be eligible to participate, you must have a body mass index of 19 or higher. Get started by enrolling at wgresorts.realappeal.com from your smartphone, tablet, or personal computer. This slide shows the journey of the Real Appeal program with UMR. Here's how to find a provider for the minimum, base, HPP, and PPO plans. There are two ways. You may go to umr.com and select Find a Provider on the home page. UMR works with many different networks. You will see a list of those networks, and you will scroll down the page to find your provider network, which is UHC Choice Plus. You will find the name of the provider network on your ID cards. Then follow the prompts to look for a network provider in your area. Or, after registering and logging into the member portal of the website, you can click on Find a Provider, and you will automatically be directed to the correct network. Lastly, if you would rather not look on the website, you can always call UMR, and a customer service rep will help you find a provider. As you know, costs for the same products and services can vary widely depending on where you go to purchase them. The same goes for medical treatments and procedures. My Healthcare Cost Estimator is an innovative tool that gives you easy access to the information you need to make informed healthcare decisions prior to having treatment. My Healthcare Cost Estimator can help you through every step of your treatment. It allows you to find treatment options and learn about recommended care. You can even create a care path to track the appointments, tests, and follow-up care related to your healthcare needs. How much you pay and how long you wait may depend on where you go. Make sure you choose the right setting for your needs. Use NurseLine to speak by phone with a registered nurse any time of day, 7 days a week. Call to get help choosing the right healthcare setting for an illness or injury, or information about common health problems or injuries. Use Teladoc to request a consultation from a board-certified doctor any time of day, 7 days a week, by phone or online. Teladoc physicians can diagnose routine ailments, recommend treatments, and prescribe medications. Retail clinics, sometimes called convenient care clinics, are located in retail stores, supermarkets, and pharmacies. They offer routine care for colds or flu, vaccinations or screenings, sinus infections, minor sprains, burns or rashes, allergies, headaches or sore throats. Urgent care centers, sometimes called walk-in clinics, are often open in the evenings and on weekends. They offer timely care for sprains and strains, minor broken bones or cuts, mild asthma attacks, minor infections or rashes, sore throats, earaches. Visit your doctor's office for clinical care. Seeing your doctor is important. Your doctor knows your medical history and any ongoing health conditions. See your doctor for preventative services and vaccinations, medical problems or symptoms that are not an immediate, serious threat to your health or life. Visit the ER only when you are badly hurt. If you are not seriously ill or hurt, you could wait hours and your health plan may not cover non-emergency ER visits. Go to the ER for any sudden change in vision, heavy bleeding, sudden weakness or trouble talking, spinal injuries, large open wounds, chest pain, difficulty breathing, major burns, a severe head injury, or major broken bones. Here are some tips to save money on emergency care. Emergency rooms are for serious conditions. Instead of going to the ER next time, take a few moments to consider an urgent care facility or retail walk-in clinic may be located inside your pharmacy. It will save you time and money. Take time now to find an urgent care facility in your area so you will know where to go the next time you need care. Another resource for you is NurseLine. The phone number is located on the back of your ID card. NurseLine is open 24 hours a day, 7 days a week. You will be able to actually talk to a nurse any time of day or night and on weekends. Perhaps you have a sick child with a fever. Do you go to the ER, or can you wait until the doctor's office is open in the morning? The nurse will help you decide what is best for you and your child. Please take advantage of this great benefit. Register at umr.com. You will be able to see your claims and those of your dependents. You can print an explanation of benefits, an EOB, in case you have misplaced the one that you got in the mail. You can order new ID cards, or print a temporary one until the new one arrives in the mail. There are also health and wellness tools on the website to help you with weight loss, exercise programs, etc. Please be aware of the expanded list of preventative health services for women. You do not need to pay a deductible, copay, or coinsurance as long as you go in-network for the services listed. Please note, this is not a complete list. Refer to the flyer within PlanSource. Here is a sample of the UMR Medical ID card if you are enrolled in the minimum, base, HPP, or PPO plans. Manifest RX. Find drug prices at all of your favorite pharmacies, including most drugstore chains, big box retailers, and your local mom and pop. Or, if you're like most people are now, choose free home delivery. You do not have to be enrolled in a Westgate medical plan to be eligible. Visit it today at westgate.manifestrx.com. To help manage the rising prescription drug costs, we have added a voluntary program for certain brand name maintenance medications. The program's name is WG Meds, offered through Canna RX, an international pharmacy program. Advantages of joining WG Meds are a $0 copay for all brand name prescriptions offered through the program, so no out-of-pocket expense. Prescriptions are shipped directly to your home with no shipping and handling costs. Review the enrollment plan, which includes the list of brand name maintenance medications. And by getting your prescription through WG Meds, you will have a $0 copay and receive a $50 gift card for your first prescription fill. This program is available for participants in the base, HPP, PPO, and HSP plans only. This does not replace your prescription coverage with UMR. Visit the website shown here for further details. Maxer Plus MXP Pharmacy offers a convenient, cost-effective way to order medications for home delivery. Medications obtained through mail order are limited to a 90-day supply. Once MXP Pharmacy has your prescription, refills can easily be obtained. You can ask your doctor for a new prescription written for up to a 90-day supply with refills up to 1 year. The doctor may fax, send electronically, call, or give you a written prescription to mail. For questions regarding your mail service program, please call MXP Pharmacy. The Maxer member portal and mobile app lets you sign up for mail order and new mail order prescriptions and refills, view and print prescription history, update credit card information, manage dependents, locate pharmacies, and calculate your copays. You will need to create an account when you go to the member portal for the first time. You will need your member ID card to complete your registration. To create your portal account, follow the steps as outlined on this slide. Your plan also includes My Maxer Link, a free way to receive helpful information about lower cost prescriptions on your phone. It's free and convenient. Helpful information about lower cost prescriptions is sent securely to your phone. There's no app required. Look for this flyer in your enrollment packet. Have your member ID card ready and sign up by calling 888-596-0723 or go to mymaxerlink.com/maxerplus. MyMaxerlinks offers several programs and allows you to schedule notifications and reminders as shown on this slide. Our dynamic discounts rewards members with lower copays for maintenance medications. Your prescription drug plan offers you the opportunity to reduce your out-of-pocket cost paid for specialty drugs. Westgate Resorts offers a prescription drug plan through Paid Health. This plan provides additional support to members' prescribed specialty drugs and products. Prior authorization and participation is required of those members who have prescribed specialty medication within the program. A case coordinator will reach out to you when and if appropriate to guide you through this program. Additional pharmacy options that can save you money are Costco and Walmart. Team members and their families enrolled in the BASE, HPP, PPO, and HealthScope plans should take advantage of Costco. You do not need to be a member. You simply show your UMR ID card and you will pay nothing for generic medications or $20 for preferred and $40 for non-preferred medications. As a reminder, under the BASE plan, you will still need to meet the prescription deductible of $300 for an individual, $600 for a family, prior to that benefit. Walmart offers a wide range of generics for $4 for a 30-day supply and $10 for a 90-day supply. If you have a Publix or Sam's in your area, you can take advantage of their offerings as well. Free ACE inhibitors, antibiotics, and metformin. With a medical FSA, you are able to contribute up to $2,850 annually to pay for medical, dental, and vision expenses with pre-tax dollars. With a dependent care FSA, this year, you can contribute up to $5,000 annually to pay for dependent care services expenses with pre-tax dollars. This benefit is offered to all full-time team members who have satisfied 1 year of employment effective in June each year. FSA funds will not roll over to the next plan year, so be conservative in making your election for the 2022-2023 plan year. Any unused funds left in your healthcare or dependent care FSA at the close of your grace period, which is August 15th, 2023, are not refundable to you. The grace period means that you are given an additional 2.5 months to incur new expenses with prior plan year funds. At the end of the grace period, August 15th, 2023, all unspent funds must be forfeited according to the IRS. You will have 90 days after the plan year ends to submit dependent care claims that were incurred during the prior plan year. How much should you contribute? Add up all of the out-of-pocket expenses you had last year. This includes copays, deductibles, coinsurance, prescriptions, dental, vision, any child or elder care, and voluntary health policies not payroll deducted. This amount will help you estimate your out-of-pocket expenses for this plan year. You may contribute up to $2,850 for the healthcare FSA and up to $5,000 for the dependent care FSA. The dependent care expenses providing during a calendar year cannot exceed $5,000 a year for individuals or married couples filing jointly. This slide gives you an example of the savings when you contribute to an FSA, either by contributing to a health and a parent care FSA, or just one or the other. What you contribute affects the amount of savings you will see. Again, you are urged to take precautionary steps when determining what you will contribute and track account balances on the Flex System website and/or using the interactive voice response system to avoid having funds remaining in your account at the end of the plan year, because the FSA funds do not roll over. The Coronavirus Aid, Relief, and Economic Security, or CARES Act, allows tax advantage plans like healthcare FSAs and HRAs reimbursing 213D eligible medical expenses to once again pay for or reimburse for over-the-counter drugs and medicines. These items no longer require a prescription or physician's note. This is subject to change with the response to COVID-19. Please note also that PPE is included. Here are some other examples of eligible and ineligible expenses for healthcare FSAs. Here are some examples of eligible and ineligible expenses for dependent care FSAs. You will receive the TASC Smart Card upon plan enrollment mailed to your home. This acts as a debit card and will come preloaded with the amount of your annual contribution for your healthcare FSA. The task card will also work for your dependent care FSA, but only with the available account balance. This will provide direct payment while at your provider when swiped from your FSA based on the balance on the card. Using the card eliminates out-of-pocket purchases and reimbursements for eligible healthcare expenses and eligible dependent care expenses. One additional card will be provided for a dependent or spouse at no charge. Additional task card features: no claim forms to complete. The task card cannot be used for expenses incurred in the prior plan year. The task card does not expire for 4 years. Make sure you keep your receipts if requested to substantiate your claim. The MyTask mobile app provides you with the ability to view real-time account balances. You can request a reimbursement, or you can submit receipts using your device camera, or view plan information, contributions, and transactions. With MyTask text messaging, you can request your account balance or a reimbursement. Understanding Medicare when you are working and over 65 can be a challenge, and Westgate has partnered with Transitions to help you with your options. Please call or email Transitions if you are over 65. For team members and/or spouses who are 65 and older, Medicare can be an appealing alternative to group insurance, but there are a lot of questions. How does Medicare affect me or my spouse when I'm still working? When do I enroll? How does it compare against the plans offered through Westgate? Many of your current doctors also accept Medicare, and you have the choice of many different insurance carriers. The deductible, co-insurance, and your out-of-pocket maximums can be far less than the current UMR plans. Prescription copays can be less as well. Transitions can assist you and your loved ones prepare for tomorrow by providing educational support, life stage and Social Security planning, Medicare coordination, COBRA alternatives, and more. Our partner Transitions is offering educational webinars on demand. Remember, this is at no cost to you, and you are under no obligation to move to Medicare. They are simply here to help you with your questions and educate you on your options. Westgate Resorts will continue to offer 2 dental plans with Delta Dental. A DHMO plan is available in Florida, Missouri, Nevada, New York, South Carolina, Texas, Utah, and Virginia only. There are no deductibles, coinsurance, annual, or lifetime limits. It includes 1 cleaning per 6-month period. This plan has a schedule of benefits with predetermined copays. The out-of-pocket costs are clearly defined. You must receive care from a Delta Care dentist in network only. Orthodontic coverage is available for children and adults. You must select a dentist during online enrollment. If you wish to change at any time, please call customer service. A PPO plan is available nationwide. There are in and out of network benefits, but staying in network is the best value. Deductibles, coinsurance, and annual limits apply. It includes 2 cleanings in a 12-month period. You are able to stay with your current dentist even if not participating and still receive benefits out of network. Orthodontic coverage is available for dependent children to age 19 only. Dental implants are covered. And new this year, a diagnostic and preventive max waiver, which means diagnostic and preventive dental services will not count towards your annual maximum. As previously stated, with this plan you are responsible for copays when receiving services. There are no deductibles or coinsurance amounts. There is a schedule of covered benefits and copays associated with each service. As an example, depending on the type of crown needed, which would fall under major care, your copay will range between $195 and $355. You can find out what the cost will be prior to having any dental work done. You may refer to the DHMO schedule within the PS library. The dental HMO provides dental benefits through a network. It is important to understand that there is no out-of-network reimbursement. To receive the benefit from this plan, you must make sure you visit a dentist who is in the plan. Please make sure there is an in-network dentist available in your area before enrolling in the DHMO. Again, this plan is not available in all areas. During your online enrollment, you will have access to the dental directory. You will need to choose a Delta Care DHMO dentist at the time of enrollment. If you do not select a dentist, one will be assigned to you based on your zip code. Additional information is available on how to look up a network provider within PlanSource. The DPO plan is available nationwide. You will notice that the benefit percentage is the same in and out of network. However, staying in network is the best value as your percentage is based on the discounted rate. Whereas going out of network to a non-Delta dentist, they may balance bill you for the amounts not approved by Delta or over what Delta will pay. Remember, deductibles do apply for basic and major services, $75 per person or $225 per family. The coverage is 100% for preventative, which would be cleanings. Please be sure to take advantage of the 2 cleanings in a 12-month period with this plan. The deductible is 80% for basic, which are fillings, extractions, endodontics and periodontics, and 50% for major treatments, which would be crowns and dentures. There is a $1,500 annual limit per person per calendar year. You are able to stay with your current dentist even if they are not participating and still receive benefits out of network. But be aware that the dentist could balance bill you. Orthodontia coverage is available for dependent children to age 19 only. Dental implants are also covered on this plan. With the dental PPO or DPO plan, there are two different networks to choose from: in-network, or you can go out-of-network. In-network dentists have a contract with Delta which provides reduced fees to members, no balance billing, and no claim forms. See the bullets in the first box. Delta also offers a unique secondary in-network group of providers, which is the Delta Premier Network. This network is larger than the dental PPO. 80% of dentists nationwide participate in this network. Refer to the bullets in the second box. Or, members can visit out-of-network dentists, but they will be responsible for any fees beyond reasonable and customary charges, and could be asked to pay the entire fee at the time of service. Refer to the bullets in the third box. When viewing the online directory, you can specifically select the system to pull a list of PPO or Premier dentists so you are able to see all your options. Here is a side-by-side comparison of the DHMO versus DPO for your reference. This is also located in the Benefit Highlights booklet. As already communicated to you, and for your reference, here are the bi-weekly team member contributions for dental. The premiums for dental have stayed the same this year. For your reference, here are the dental weekly contributions. VSP's Vision Plan is to assist you with vision care expenses by providing both an eye examination and materials, lenses and frames or contact lenses. VSP Vision Plan is called Choice. VSP is affiliated with Costco Optical, Eye Care Centers of America, and other high-quality retail chains. To find a VSP doctor or retail chain affiliate, visit VSP.com or call 800-877-7195. The Vision benefit gives you the freedom to select either an in- or out-of-network provider and still have coverage, although we recommend going in-network to receive the most from this coverage. You may receive one eye exam and one pair of prescription glasses or contacts every 12 months. The plan has copays and a maximum allowance for frames and contact lenses. This plan offers a select set of eye care services for members diagnosed with type 1 diabetes for an additional $20 copay. Westgate Resorts offers life and disability benefits through Mutual of Omaha to include employer-paid basic life and accidental death and dismemberment, voluntary life and AD&D, voluntary short-term disability, employer-paid long-term disability. Westgate Resorts covers the cost of basic life and accidental death and dismemberment for both full-time, hourly, and salaried team members. Full-time team members will be automatically enrolled in the appropriate coverage level. You are required to designate a beneficiary online through PlanSource. This can be changed at any time. Voluntary employee life coverage is available in $10,000 increments up to the lesser of $500,000 or 7 times your annual earnings. This year, during open enrollment, an increase of up to $30,000 annually for employee voluntary life will be allowed without an evidence of insurability. This is a great opportunity to increase your coverage without needing to complete an EOI. Spouse voluntary life coverage is available in $5,000 increments up to the lesser of 50% of the employee selected coverage up to $250,000. Child voluntary life coverage is available in two options, $5,000 or $10,000 amounts, regardless of the number of children. The employee must have elected at least $10,000. Life and AD&D coverage is offered together. Evidence of insurability, EOI, is required for new elections outside of initial new hire eligibility. Voluntary short-term disability. The plan replaces 60% of your pre-disability base salary up to a maximum weekly benefit of $2,000 should you become sick or experience a non-work-related injury. Benefits begin on the 15th day of an accident or illness. Maternity coverage is included. Benefits can continue up to a maximum of 24 weeks. Keep in mind, there is a 3-month look-back period from the time you elect coverage. That means, for example, if you are currently being treated for a medical condition and you choose short-term disability during this open enrollment, this condition will not be covered for 6 months. EOI is not required during open enrollment for new elections, but is required at any other time. Long-term disability is company paid and protects your loss of pay when you are sick or injured and unable to work, non-job related. You are automatically enrolled if you are enrolled in one of the UMR medical plans through Westgate. Your benefit is equivalent to 40% of your taxable monthly earnings, not to exceed $7,000 monthly. There is a 3-month look-back, which means if you have been treated for any medical condition 3 months prior to coverage, that medical condition will not be covered for 12 months. This would not apply if you elected voluntary STD. There will be a 180-day waiting or elimination period before receiving this benefit. The transition from voluntary short-term to long-term disability benefits will be coordinated through Mutual of Omaha and your doctor's office. The Voluntary Accident Insurance Plan is offered from Voya. The purpose of this policy is to cover off-the-job accidents and injuries. There is a listing of specific injuries, accidents that are covered, and what the benefit amount will be for that specific injury or accident. The accident insurance pays directly to you, regardless of other insurance you may have, such as medical, auto, or short-term disability. Also, you do not need to be enrolled in UMR's medical plan. It is available to you and your family. Important to note is that the wellness rider is part of the plan, which will pay, directly to you, $150 when certain wellness-related tests are performed. What this means is that you and your covered spouse can each receive a benefit of $150 for certain wellness-related tests. For example, when you have routine physicals, mammograms, colonoscopies, or other tests that are listed in the accident insurance brochure, you and your spouse can each receive the $150 benefit. No evidence of insurability if electing past your initial eligibility. This benefit resets each calendar year. The wellness benefit encourages wellness-related tests and rewards those employees that take the time to get those tests done. You will receive a packet of information once enrolled that will explain how to file a claim. Westgate is offering new enhancements to Voya's accident plan, including increased benefits to emergency room treatment, hospitalization, and ambulance services. Here is the schedule of benefits for specific fractures and dislocations and the flat dollar amount Voya will pay to you after an accident. Open reduction means that a wound requires surgery. Closed reduction means that a wound does not require surgery. This slide shows the voluntary accident rates for team members and their family. The Voluntary Critical Illness Plan from Voya pays a lump sum benefit if you are diagnosed with a covered illness or condition. Critical illness insurance is a limited benefit policy. It is not health insurance. Features of critical illness insurance include: there are no medical questions or tests required for coverage. It is a guaranteed issue. You can use the benefit money for any purpose you like. Premiums are paid through convenient payroll deductions. The plan also pays out an annual wellness benefit if you complete a health screening test. You may only receive a benefit once per year, even if you complete multiple health screening tests. Examples of health screening tests are pap tests, serum cholesterol test for HDL and LDL levels, mammography, colonoscopy, and stress tests on bicycles or treadmills. The annual benefit is $50 for completing a health screening test. If your spouse and/or children are covered for critical illness, they are also covered by the wellness benefit. Your spouse's benefit amount is also $50. The benefit for child coverage is 50% of your coverage, with an annual maximum of $100 for children's benefits. Critical illness insurance can help you when you are diagnosed with one of the covered illnesses or conditions listed here. Some examples would be medical expenses such as deductibles and copays, childcare, home health care costs, mortgage payments and rent, and/or home maintenance. Premiums are based on your age and tobacco status and can be viewed when enrolling online in PlanSource. Further details are also included in the benefit highlights and summary plan description, and also available in the PlanSource library. This slide shows the voluntary critical illness rates for team members and their families. The Voluntary Hospital Indemnity Plan from Voya can help you pay any expenses for a hospital stay that are not covered by your medical insurance, such as your deductible or coinsurance. You can choose from 2 plans with different coverage levels to best meet your needs. Features of a hospital indemnity high plan include no pre-existing condition limitations and no age reductions. You can use the benefit money as you see fit. For example, to help copays, deductibles, and coinsurance costs due to hospitalization or lost time from work. Premiums are paid through convenient payroll deductions. This plan also pays out an annual wellness benefit if you complete a health screening test. You may only receive a benefit once per year, even if you complete multiple health screening tests. Examples of health screening tests are pap tests, serum cholesterol tests for HDL and LDL levels, mammography, colonoscopy, and stress tests on bicycles or treadmills. The annual benefit is $50 for completing a health screening test. If your spouse and/or children are covered for critical illness insurance, they are also covered by the wellness benefit. Your spouse's benefit amount is also $50. The benefit for child coverage is $25, with an annual maximum of $100 for children's benefits. Features of a hospital indemnity low plan include no pre-existing condition limitations and no age reductions. You can use the benefit money as you see fit, for example, to help copays, deductibles, and coinsurance costs due to hospitalization or lost time from work. Premiums are paid through convenient payroll deductions. With the ASPCA Pet Health Insurance Program, you can choose the care you want when your pet is hurt or sick and take comfort in knowing they have coverage. ASPCA offers customizable options for pet owners. Just pay your vet bill, submit claims, and get reimbursed for covered expenses. You're free to visit any licensed vet, specialist, or emergency clinic you want, and you can choose to receive reimbursement by direct deposit or mail. Click on the link to get a free quote, and be sure to use the Westgate priority code for additional discounts. You can add one of our preventative care coverage options for a little more each month. Each one has a list of covered services, and each service has a set maximum annual benefit amount. There's no deductible or coinsurance amount. These benefits are available as soon as your plan is effective. Things like vaccines, flea heartworm prevention, and dental cleanings can help keep your pet from getting sick. Other services like regular checkups and wellness screenings let your veterinarian detect health problems in the early stages, which can mean a better outcome for your pet. If you're already paying for your pet's preventative care, why not get cash back for it? The Client Advocate Center is a free benefit to you and any covered dependents enrolled in any of the Westgate Resort benefit plans. As you are aware, online enrollment is done by accessing PlanSource. All passwords have been reset for open enrollment. To review briefly, you will log into benefits.plansource.com. Your user ID will be a combination of the letters WG and your 5-digit employee number, for example, WG00234. Passwords have been reset to your date of birth in the following format: the 4-digit year, followed by the 2-digit month, and the 2-digit day. Once you log in with this default password, you will be prompted to create a new password. It is important to point out that you should verify that all data is accurate when accessing the system: name, address, dependents, dates of birth, Social Security numbers, and current plan elections. Click on Get Started to begin and shop for your benefits. The system will require you to add or include beneficiaries in order to proceed. You must click the Checkout button at the bottom of the enrollment page in order to lock in your elections. Otherwise, your updates will not be applied. Benefit plan and life event information are located in the Documents section, including this presentation, the open enrollment memo, and the benefits highlights and summary plan description, along with required notices. All of this can be accessed at any time, not only during the annual open enrollment. Important information: if you are covering a spouse, you will need to log into PlanSource to answer the spousal surcharge question about your spouse's alternative medical insurance coverage, even if you answered this question last year and nothing has changed. It is critical to ensure that your beneficiaries are always up to date. Now you're ready to enroll. Please go online to review all your data: name, address, dependents, dates of birth, Social Security number, and current plan elections. Review further detailed benefit summaries and the new deductions that apply to you. Determine if you need to make changes. All changes must be updated in ADP. If you wish to add, drop, or change coverage, you must do so by going online no later than Thursday at 11:59 p.m. on May 12th, 2022. This concludes the presentation for open enrollment. Any questions can be emailed to benefits@wgresorts.com. Thank you for your time.